Hello and welcome to Medical Bulletin. This is me, Nana with you. Today's news. MCI arranges second year Limina Pharmaceutical Cold Chain Forum. IFEM organizes Trauma Symposium 2015 at Abu Dhabi. New medication to help limit the spread of hepatitis C in UAE. WHO and Republic of Korea to carry a joint mission for MERS coronavirus outbreak in Geneva. WHO calls for increase in voluntary blood donor to save millions of lives in Geneva. WHO and partners align on a new way forward to measure impact of country health programs in Geneva and Washington. MOH and MOE in Kingdom of Saudi Arabia signs MOU in the fields of medical education, scientific and strategic research. Now the news in detail. MCI arranges second year Limina Pharmaceutical Cold Chain Forum.
The two-day occasion brought all partners from governments, services, pharmaceutical organizations, social insurance snakes, technologists, logistics suppliers and advisors together to talk about how to deal with the district's IC chain all the more productively with the goal of enhancing patients' care. The appreciated discourse was tended to by Dr. Ibrahim A. Al-Sara, President Saudi Pharmaceutical Society, and Intuitive Board examinations were additionally directed.
I am happy, delighted to be the chairman of the conference. This is the second conference. It's a talk about pharmaceutical cold chain product. And just to give an idea, an insight about what we mean by pharmaceutical cold chain product, any product that are very sensitive to the temperature change. When you have like a product like vaccine or hormones, all these products are very sensitive to any slight temperature change. So by any modification, by any slight temperature change, it may lead to the damage or the breakdown of the product, which may lead to serious side effect.
The second annual forum for the cold chain in pharmaceutical arranged in Dubai, this beautiful city. We will speak today about the cold chain importance in warehouse and importance in controlling the temperature in warehouses.
Really, I'm a panelist here in this conference of cold supply chain. It's very important event. Really, it puts a lot of shades on the cold supply chain challenges and hurdles and needs all over the MENA region. Everybody admitted that we need to unify the standards and the ways we regulate the supply chain and define the gaps in the cold supply chain for the sake of the end user or the consumer, the patient and the public health as well.
IFEM organizes Trauma Symposium 2015 at Abu Dhabi.
On behalf of the International Federation for Emergency Medicine and the Emirates Society of Emergency, organized the first IFEM Trauma Update Symposium in Abu Dhabi. This joint symposium is a result of a great collaboration from IFEM and ESEM to promote the specialty of trauma care and offers a wonderful opportunity for academic or scientific exchange. The scientific program covered wide aspects of trauma care, including pre-hospital care, trauma updates, trauma system discussions, research, nursing, military medicine, and pediatric trauma care. The symposium is expected to strengthen the knowledge and relationship amongst all trauma care providers, physicians, surgeons, nurses, paramedics, or residents and help improve the trauma care and save more lives.
So this is the first collaboration between the Emirates Society of Emergency Medicine with the International Federation of Emergency Medicine, which is the biggest organization for emergency medicine internationally. We thought of working on and focusing on an important topic to the UAE specifically, which is trauma. Because it's the second leading cause of a death in the Emirate, and all health authorities in the country are focusing on to decreasing the burden of this disease.
Basically, it is a trauma symposium, which is a conference that is held based on the International Federation of Emergency Medicine, and it basically brings in the paramedic system as well as emergency and trauma surgeons together to discuss updates in the fields of trauma. And there are so many interesting topics. You will see a variety of healthcare providers here. There are paramedics, there are nurses, there are doctors, surgeons, as well as emergency. And so all specialties are coming together to discuss trauma system in the UAE and how to promote it and improve it.
New medication to help limit the spread of hepatitis C in UAE.
New medication and screening program to fight hepatitis C in UAE has been approved for use in the UAE and is to be used by doctors as part of a nationwide screening program to detect the virus. Doctors predict that number could be higher, with some people unaware that they are carriers because up to 80% of those who show no visible symptoms. About 350,000 to 5 lakh people worldwide die from hepatitis C related liver diseases each year. Latest MOH figures suggest up to 20,000 Emiratis may carry the hepatitis C virus, and as many as 18,000 expatriates are also thought to be infected.
WHO and Republic of Korea to carry a joint mission for MERS coronavirus outbreak in Geneva.
In the light of the late flare-up of Middle East respiratory disorder coronavirus, WHO and the Republic of Korea's Ministry of Health and Welfare will direct a joint mission in the Republic of Korea. The mission comes after close meeting in the Middle East of WHO and the government. The WHO group will be driven by Assistant Director General for Health Security Dr. Keiji Fukuda. The group will be embodied specialists in the study of disease transmission, virology, clinical administration, contamination anticipation and control, and general well-being officers who have beforehand taken care of different MERS coronavirus episodes in the Middle East.
WHO calls for increase in voluntary blood donor to save millions of lives in Geneva.
On World Blood Donor Day, 14 June, the WHO called for expanded consistent blood gifts from intentional unpaid benefactors so as to spare a large number of lives, all inclusive each year. The topic of current year's crusade is "Thank you for saving my life." It energizes givers everywhere throughout the world to give blood deliberately and frequently with the trademark "Give uninhibitedly, give regularly, blood gift matters." The most ideal approach to ensure a sheltered and satisfactory supply of blood and blood items for transfusion is to have a decent supply of customary gifts by willful unpaid blood benefactors. The most ideal approach to ensure a sheltered and satisfactory supply of blood and blood items for transfusion is to have a decent supply of customary gifts by willful unpaid blood benefactors, says Dr. Margaret Chan, WHO Director General. WHO urges every member state to get all their blood supplies from such benefactors.
WHO and partners align on a new way forward to measure impact of country health programs in Geneva and Washington.
The U.S. Organization for International Development, World Bank Group, WHO, and nations are meeting up at the World Bank Group for an abnormal state summit, measurement and accountability for results in health to inspect and develop a typical motivation for well-being estimation as we move up into the post-2015 advancement era. Accurate and convenient well-being information are likewise the establishment to enhance general well-being. Without dependable data to set needs and measure results, nations and their advancement accomplices are working oblivious, said Margaret Chan, Director General of WHO. Putting resources into estimation is an interest in well-being, and nations that construct and fortify neighborhood limits are better suited to accomplish more noteworthy long-haul achievement and better well-being results.
MOH and MOE in Kingdom of Saudi Arabia signs MOU in the fields of medical education, scientific and strategic research.
Pastor of Education Dr. Azam Al-Dakil and the Minister of Health, Engineer Khalid Al-Fali, have marked an update of comprehension and collaboration concentrating on different key topics to initiate the basic objectives between the two services to serve the Saudi group in the well-being segment, as per the most elevated worldwide benchmarks. The reminder likewise included enacting normal preparing and improvement with a perspective to exploiting the Ministry of Health, healing facilities, specific well-being focuses, restorative urban communities and essential health awareness focuses to fill the need of preparing postgraduate projects, proceeded with therapeutic training projects, partnership specializations which promises building of experimental and examination associations between the two ministries.
So that's it for today. Take care.